Hi, my name is TK Touchconraudio. I work as a massage therapist at Bodyflow Clinical Yoga Massage, Hamilton, New Zealand. For many years of practicing as a massage therapist, shoulder pains are common issues that bring many people to our clinic. I have studied AC joint injuries by researching and gathering information from the second data source. I am pleased to share my findings with you today. The components we are going to discuss will include etiology, which talk about biomechanics of injury, potential internal and external causal factors, incidence rate of injury, and after that we will discuss about pathophysiology, which is about injury-specific anatomy, signs, symptoms, and level of dysfunction. Also, injury-specific tissue healing procedure. Assessment of injury, which include on-field assessment process and clinical assessment process, will also cover in this discussion. More than anything, yes, treatment of injury. We will talk about it too. In addition, the specific injury prevention strategy for female athletes, children, and elderly will come across at the end of the discussion. AC joint injuries biomechanics. Your AC joint or acromioclavicular joint is the joint at the very top of your shoulders. Usually, injuries to this joint happen because you have fallen or rolled onto your shoulder. The way it is treated depends on how bad your injury is. How bad is it depends on how many of the ligaments that join your collarbone and shoulder blade are affected. We are now happen to know that sport injuries such as bicycle or rugby or many other things about contact sports can cause AC joint injuries. Also, the fall with the arm in an adducted position is also dangerous. What about internal factors? The studies mention that osteoarthritis is a common disorder of synovial joints, which also causes AC symptoms in adults. While talking about incidence rate of injuries, we found that male gender and younger age group were risk factors for injury, whereas the risk for high-grade injuries were greater in older patients and after traffic accidents. These injuries occur 5 times more frequently in men than in women, with the highest incidence in the 20 to 30 years old age group. Before we discuss in more details about the level of dysfunction of the AC joint injuries, is it better to know about what is AC joints and get more knowledge about AC joint anatomy? The AC or acromioclavicular joint is the joint between the clavicle or collarbone and scapula or shoulder blade. It is commonly injured by falling and landing on the point of the shoulder or landing on an outstretched hand. There are 3 ligaments which keep the clavicle attached to the scapula. These are called the acromioclavicular ligament or AC ligament, the trapezoid ligament, and the conoid ligament. Together, the trapezoid and conoid ligament are called the coracoclavicular ligaments or CC ligaments, as they both originate on the coracoid process. Also, soft tissue. The deltoid and trapezius muscles are especially important in providing dynamic stabilization when these ligamentous structures are damaged. The common signs and symptoms of AC joint injury are pain when lying on the involved side, loss of shoulder motion, loss of shoulder strength, superior shoulder pain and swelling, or a visible bump above the shoulder. Injuries to the AC joints are graded according to the degree of ligament damage and the amount or direction of the clavicle displacement. The radiographic classification of AC joint injuries described by Rockwood includes 6 types. Type 1 to Type 3 AC joint injuries are the most common injuries. And for the Type 4 to Type 6, typically receive surgery. In some cases, Type 3 injuries that do not respond to the therapy are managed surgically. In details, Type 1. Clavicle not elevated with respect to the acromion. AC ligament mild sprain. Coracoclavicular ligament intact. Joint capsule intact. Deltoid muscle intact. Trapezius muscle intact. Type 2. Clavicle elevated but not above the superior border of the acromion, and AC ligament ruptured, coracoclavicular ligament sprain, joint capsule ruptured, deltoid muscle minimally detached, trapezius muscle minimally detached too. Type 3. Clavicle elevated above the superior border of the acromion, but the coracoclavicular distance is less than twice normal. AC ligament ruptures, CC ligament rupture, joint capsule ruptured, deltoid muscle detaches, trapezius muscle detaches. Type 4. Clavicle displaced posterior into the trapezius, AC ligament rupture, CC ligament rupture, joint capsule rupture, deltoid muscle detached, trapezius muscle detached. Type 5. Clavicle is markedly elevated and coracoclavicular distance is more than double normal. AC ligament rupture, CC ligament rupture, joint capsule rupture, deltoid muscle detaches, trapezius muscle detaches. Type 6. Clavicle inferiorly displaces behind coracobrachialis and biceps tendon, which is rare. AC ligament ruptured, CC ligament ruptured, joint capsule ruptured, deltoid muscle detached, trapezius muscle detached. Injury-specific tissue healing procedure. The stages of wound healing are a complex and fragile process. Failure to progress in the stages of wound healing can lead to chronic tissue injuries. There are 4 different phases. The first one is blood clotting or hemostasis. This results in the activation of fibrins, which form a mesh and acts as a glue to bind platelets to each other. This makes a clot that serves to plug the break in blood vessels in order to slow and prevent further bleeding and inflammation first. During this stage, damaged and dead cells are cleared out, along with bacteria and other pathogens or debris. This happens as we understand the process of phagocytosis, where white blood cells engulf debris and destroy it. And the next stage will be proliferation or growth of new tissue. In this stage, angiogenesis, collagen deposition, granulation tissue formation, and wound contraction occur. In wound contraction, myofibroblasts decrease the size of the wound by gripping the wound edge and contracting using a mechanism that resembles that in smooth muscle cells. When the cells row are close to complete, unneeded cells undergo. And then the last one will be maturation or remodeling, tissue remodeling stage. During maturation and remodeling, collagen is realigned along tension lines, and cells that are no longer needed are removed by programmed cell death or apoptosis. On-field assessment of AC joint injuries. The history taking, what kind of accident occurred, will be asked, and is there pain and on which location? Need to check in details. Is there arm paraesthesia? For the critical assessment process, physical observation is very important to check the possible abrasions of the shoulder, initially from the injury, swelling, and point tenderness in the AC joint area. Is there any prominence of distal clavicle as a result of inferior displacement of the scapula? Or if the pain is increased with AC joint loading on arm abduction and cross-body adduction. See if the skin could be tented over the clavicular tip on more severe type 3 to type 5 injuries. Is there any pain on the neck in trapezius muscle, which is come from soft tissue injury. Physical examination is also very important to palpate the AC joint tenderness and see if the shoulder range of motion is typically limited by pain, and check if the motion that results in AC joint loading, such as cross-body adduction, may exacerbate symptoms. And examination on sitting, standing position increase deformity from arm weight. Is the clavicular dislocation passively reducible? This is type 3 injury. For type 4 and 5 injuries, clavicular tip is through deltotrapezial fascia and not reducible. And type 6 injury, distal clavicular, is palpable under coracoid process. Palpation of the AC joint. When AC joint pathology is suspected, we should palpate above the joint to feel for any crepitus or step-off sensation that may indicate AC separation. Also, tenderness of the joint is usually present in every AC joint disorder. AC joint stability tests. Resist AC joint extension test is used to help identify acromioclavicular joint pathology in both traumatic and non-traumatic, and can be useful in helping differentiate between AC joint and impingement syndromes. The steps to perform resist AC joint extension tests are: first, the patient is seated with the therapist standing behind. After that, the patient's shoulder is positioned into 90 flexion and internal rotation, and the therapist places hands on the patient's elbow and asks patient to horizontally abduct the arm against isometric resistance. If a positive test, there will be a pain at the AC joint. Cross-body adduction test or scarf test is used to assess the integrity of the acromioclavicular joint techniques. The test is performed by passively bringing the patient's arm into 90 degrees of forward flexion, with elbow also flexed to 90 degrees. The examiner then horizontally adducts the flexed arm across the patient's body, bringing their elbows towards the contralateral shoulder. The position result is compression of the medial acromion facet against the distal clavicle to provoke symptoms at acromioclavicular joint. The Bell-Van-Wright test, or BVR test, is essentially the cross adduction test with the addition of attempted elevation against resistance. In a positive test, this results in some pain and the inability of the patient to maintain the arm in the adducted and elevated position against resistance. For the upper extremity evaluation, observation, palpation, and all kinds of special tests, it helps us to understand the proprioception and the value of the result of functional assessment to identify the injuries that are possible to occur with AC joint injuries. What are the benefits of imaging of AC joint injuries? X-ray imaging focus on AC joint can be used to differentiate between injury types. Stress radiographs can be used in later injury state when worst pain has subsided. For the MRI imaging, it shows directly ligament disruption, unlike X-ray that measure osseous relationship. This is valuable finding potential associated injuries that can direct surgical management. Arthroscopy for AC joint injuries. In arthroscopy in surgical managed AC joint injuries reveal 18% further associated injuries requiring additional surgical intervention. Yes, treatment of AC joint injuries is very important to discuss about. Type 1 and 2 conservative. Sling immobilization, ice pack helpful for pain close to skin. Non-steroid anti-inflammatory pain medication such as ibuprofen. Activity modification complete rest. Type 1 immobilization, 1 week usually enough. Type 2 until asymptomatic. At that time, start passive and active shoulder motion. Contact sport. Heavy lifting can resume when free of pain. Symmetric shoulder motion and strength to other side. The treatment for type 3. The systematic review of published treatment protocol recommend 3 to 4 weeks of conservative management trial. Individual needs, for example, at least with elderly, would wait on decision for surgical conservative management. AC joint steroid injection. In refractory pain to medication, AC joint steroid injection can be used to mitigate the pain and also as a diagnostic test. Surgical management of AC joint injury reserved to type 3 injuries, where conservative treatment has been unsuccessful, and to type 4 to 6 injuries. Scope of other health professionals. There are many professionals that get involved in the AC joint injuries, but in this discussion, we will talk about 3 professionals that are playing a majority roles, which are orthopedic surgeons. The doctor who specialize in the musculoskeletal system, the bone, joints, ligaments, tendons, and muscle. This let them diagnose, treat, and even prevent orthopedic problems with next level precision. The next one is clinical exercise physiology. Exercise physiologists analyze a patient's medical history to determine the best possible exercise and fitness regimen. Exercise physiologists develop fitness and exercise programs for rehabilitation process that help patients recovery from chronic disease and improve cardiovascular function, body composition, and flexibility to return to the normal life. Massage therapist is also very important because Massage therapists can use many techniques such as neuromuscular techniques to treat the soft tissue, to alleviate the pain of the soft tissue around the joint, to help the patient to have enough strength for the exercise training. Ethical and legal requirements in injury care. Professionals treating injury athlete worker person has responsibility to provide optimal care for the individual. Athletes should be given informed consent to participate with knowledge of the injury, what repercussion it might have, and then have the option of choice to continue sport with the injury or rehabilitate it. Return to play strapping and intervention for AC joint injuries. Taping is popular. Taping can support the joint and keep it stable while it is healing. If the shoulder is not taped, then the individual runs the risk of further shoulder injuries not healing properly, resulting in long-term deformity. The last topic we are going to talk about in this discussion will be specific injury prevention strategies for female athletes, children, and elderly. Female specific injury risks relevant to AC joint. Dr. Robert Schemeling, Senior Faculty Editor at Harvard Health Publishing, has shared about the gender gap in sports injuries. He explains that the most common injury among female athletes, the top second is shoulder trouble. It comes after ankle sprain. Elderly specific injury risk relevant to acromioclavicular joint. Most often, trauma such as a fall directly on the outside of the shoulder cause an AC joint injury. The World Health Organization exposed that falls are the second leading cause of unintentional injury death worldwide. Adults older than 60 years old of age suffer the greatest number of fatal falls. Besides falls, osteoarthritis is the most common cause of shoulder pain, originating from the AC joints. AC joint arthrosis or osteoarthritis of the acromioclavicular joint is more common in people who are middle-aged or upper. The National Institute on Aging of America revealed that osteoarthritis is the most common form of arthritis among older people, and it is one of the most frequent causes of physical disability among older adults. Child-specific injuries relevant to AC joint. Edwin states that children below the age of 13 years rarely sustain a complete acromioclavicular joint dislocation, but usually sustain a fracture of the distal clavicle with an intact acromioclavicular joint. Children had only a fracture of the distal clavicle with rupture of the coracoclavicular ligament complex. It found that children of 13 years and older and older usually sustain complete dislocation of the acromioclavicular joint similar to adults. In children below age 13, conservative treatment should produce good or excellent results. Finally, thank you very much for joining my presentation. I hope the information in this presentation will benefit you. Thank you.